This movement can be done from a low box, sitting on the floor, or a bench just like I am now. You're gonna need a low to moderate intensity band. Typically that's like a red band for most folks. It needs to be a closed loop. And we're gonna go ahead and we're going to choke the band on the bottom of our foot across the arch. And the band needs to be pulled so that it's now coming across the body, not away from the body. And then from here, we're gonna do something called a grapevine, where I'm gonna take this band tension and I'm gonna wrap around the back side, over across, and you don't need too many, like 1 or 2 loops is fine. And part of that's also just gonna depend on like leg length and leg width and things like that, but there does need to be some tension in the band. So from here, I'm pulling it this direction. Part of this movement is that we are gonna be working on training and increasing loading capacity of the tibia rotating underneath the kneecap in relationship to the femur. So the femur needs to stay fixed. So if you're able to set yourself up, even if you're blocked somewhere or you're in front of a mirror, that this femur needs to stay straight ahead. And then from here, we're rotating that tibia. And what we want to look out for is that hip opening like this as a compensation. So because I'm pulling this direction, kind of towards across my body, when I come to tibial internal rotation, this is an eccentric because I'm getting a little bit of help. This is the easier phase. And then I'm going to rotate against the band tension. And that's my concentric contraction. So here to here, and I have my foot, like my heel is driving down into the floor, but my toes are up off the ground. This can also be done on a slider with a flat foot if you wanted to do that, but you would need something to break up the band from the floor. And you can play around with different, you can go a little bit less knee flexion and still train in this position. Eccentric, concentric, you can go more, and same thing. And you're gonna notice that there's different, you have different rotational capacities in both directions with different levels of knee bend. When you are externally rotating in that concentric, the stuff in your lateral calf and lateral hamstring are turning and pulling that knee bone or this shin bone over. And then on the other side with the eccentric and internal rotation, this medial inside calf stuff and inside hamstring stuff is pulling to pull that tibia into internal rotation.